My name is Dr. James Cameron. I am a neonatologist here in Fort Wayne, Indiana, and we're going to be talking about neonatal abstinence syndrome. When the baby's in the newborn nursery, a lot of the mechanisms that can be used to prevent or to reduce the severity of the withdrawal symptoms are these sort of comfort measures. The comfort measures are the swaddling, the decreased lights, the soft voices. Breastfeeding. Breastfeeding is a great way to give both skin-to-skin contact for the baby and the mom. It also provides an improved bonding experience for the mom and the baby when they're going through this really difficult period, and reduces the chance that the baby's going to need to be treated with an opiate medication to lower the symptoms of withdrawal. So as we're getting ready and getting close to discharging the baby from the NICU or even from the newborn nursery, a lot of the parents and physicians expect that the baby's going to be symptom-free from withdrawal at the time of discharge. And unfortunately, that's not the case. Infants can show signs of withdrawal for several weeks after discharge from the hospital. The goal isn't to get them withdrawal-free, but it's to get them to a point where they're able to, as we said previously, able to eat, able to gain weight, able to be consoled, able to be sure that when the baby goes home, it's not going to be so irritable that the baby's at higher risk for being shaken or have non-accidental trauma. So babies that are at risk for withdrawal are going to be more irritable. When the moms and dads are taking these babies home, they need to understand that these babies are going to continue to be irritable at home, and because of that, they're at risk for shaken baby syndrome. The parents need to have good education, strong education, to know what their resources are, to know what they can do to reduce these risks to the baby and to themselves. It's okay for the baby to be left in the crib to cry, for them to walk away, for them to call and ask for help. They need to know what their resources are when they're discharged to home, because these symptoms can be severe even the first night of discharge, and nobody knows what point it is that they're going to have that event that pushes them to shake their baby, and we don't want any family to have to go through that. Babies that are exposed to opiates in utero, whether they're admitted and discharged from the newborn nursery or whether they're admitted to the neonatal intensive care unit and they're discharged from there, as they're discharged to home, they're going to need to be followed by their primary care physician to watch for symptoms to make sure that they aren't becoming more severe and that they don't need to be readmitted to the hospital, that the parents don't need additional coaching to avoid shaken baby syndrome, to make sure that the baby's gaining weight well. But beyond that, babies that are being discharged from the NICU that have been treated with an opiate, these babies are at higher risk for having developmental problems as they get older, and they're going to need to be followed in the developmental follow-up clinic or the NICU follow-up clinic. So what babies do we need to watch for neonatal abstinence syndrome? It's going to be any baby that's been exposed in utero to an opiate, whether it's a medication that the mom was prescribed for treatment of acute or chronic pain, or for moms that have been using illegal substances such as heroin, such as fentanyl, or illegally using prescription medications. All these babies are at risk for having withdrawal symptoms. In addition to the drugs that the mom may be taking illegally or the prescribed medications that the mom may be taking, some women are taking drugs for maintenance therapy programs such as buprenorphine and methadone. And although many of the families think that the baby isn't going to withdraw from these medications, the babies are actually at risk for having withdrawal symptoms, and the family should be aware of that as well as the physicians prior to the delivery of the baby so that the expectations can be set for the family and for the physician, and so that the families will know ahead of time what symptoms they should be looking for following the delivery of the baby. So when we have a mom that comes in and delivers and she's been in a maintenance therapy program, one being treated with buprenorphine or methadone, many times we want to see these families be successful, not only with the treatment program, but also being able to take the baby home and have the baby and the mother bond successfully. In order to be successful in discharging this family home together as a successful family unit, the planning for the delivery needs to happen before the baby is born. So early on in the pregnancy, while the mom knows that she's pregnant and she's in her treatment program, she needs to have the understanding of what to expect when she's going through the pregnancy. How is her need for the medication going to change over the course of the pregnancy? How is her baby going to respond to it? And a lot of times the moms are told that they shouldn't expect the baby to withdraw, but all babies are at risk for having symptoms of withdrawal, and both the physician and the mom need to be talking about this before the baby delivers. After the baby delivers, the mom needs to be watching for these signs that hopefully she's been educated about before delivery so that she can help the nurse and help the physician look for these symptoms and be an advocate for her baby. By doing this, we can build a successful family unit between the mother, hopefully the father, as well as the infant, and have them have a successful first year of life. Throughout a pregnancy, a mom is going to have verbal questionnaires addressing the potential use of opiates during the pregnancy and before the pregnancy. In addition to that, some moms will be screened with urine drug screens. At the time of delivery, the baby also may be screened with either a urine, meconium, or umbilical cord testing. The urine screening will go back a week to several weeks before the delivery. The meconium testing and the umbilical cord testing can go back into the second trimester and look for exposures. Even the moms that are in treatment programs need to understand that their baby's going to be tested with meconium, urine, and/or umbilical cord testing. But again, this is all to try and provide a safety net, not just for the mother, but also for the infant. And the goal is always to try and keep that family unit together in the most safe environment that's possible.